You are watching McLaren Port Huron Today's Health Program, and I'm speaking with Julie Dickinson, the Oncology Nurse Navigator at the Karmanos Cancer Institute at McLaren Port Huron, about breast cancer support services. Julie, thanks so much for speaking with us today.
Thanks for inviting me.
So tell us a little bit about how you help patients that you encounter.
Well, you know, there is a lot of questions and a lot of uncertainty when they're diagnosed with breast cancer. First thing that comes to mind might be some emotional stress. How am I going to handle all this? Financial issues. If they're working and they're supporting their family, or they need insurance for those type of things. So I can refer them to social worker. They can do FMLA or disability, those type of things. If they have a transportation issue, some people don't have transportation. Just their physical appearance too. As you know, there's Beauty and Healing, which is a wonderful program for any cancer patient, especially breast cancer, because they may lose their hair, they may undergo some physical changes type of thing after their surgery. So having somebody, go over things to perk you up, and cosmetics and wigs. We do have a wig bank if somebody needs a wig. We have a dietitian if somebody has some issues, they're losing weight or they don't have an appetite. So there are a lot of resources.
Seems like a breast cancer diagnosis is overwhelming no matter what. So even your title as navigator is really true to help them navigate through the whole continuum.
That's what I want to do, and that's what I like to do. So yes, I would think most people, the biggest concern they probably have is what's the next thing I do? What's next? What do I got to do? They all want a plan. So trying to get them accurate information and making sure they're making a good decision. So, some women or most women don't feel like they're adequate, or, they don't know if they're making the right choices or not. So, I would think I would need some help too. So I just think that there's so many questions and so many issues and so many treatments available that they need somebody to help them through it.
Right, absolutely. And when a patient gets that breast cancer diagnosis, it's not just them, it's their family as well.
Sure,
so.
I'm sure people who don't have families get through this fine, but I really encourage the family to get involved. I'd love for them to come and meet them. Because that's a whole other part of their life. Families can be involved. That way I know that they're going to get up in the morning, someone's going to get them up, they're going to get them something to eat, they're going to have some nutrition and fluids. So having them for a second set of ears to listen to what doctors have to say and appointments, and I love when families come. And we get involved with the families too. Sometimes patients won't say something, but the family will. So it's they need to be encouraged to participate in their care, which is great.
Yeah, and you are a resource for them for information and education too. What types of information do you usually provide?
Oh, we do have, if they do come to Karmanos, we have a Karmanos portfolio. And in it has the resources available in the Port Huron area. It has numbers to call if they run into trouble with the social worker, a nurse navigator, the office numbers, when to call the doctor. There's smoking cessation information, there's advanced directive information, there's lots of information in there. In that, I end up putting information that's more tailored. So if it's breast, there's a whole section there on breast. There's American Cancer Society information, there's nutritional information, all these things, support group information. I'll put in that portfolio and then they'll have it. And then if they need something, they can just open it up and use it as a reference, or as, just to make sure that they got their information right. Insurances are important, so, we have an insurance verifier too, that's usually we give them information about what insurance is covering and what their co-pays will be and things like that too. So I try to access give them access to whatever information I can get for them.
This is wonderful. Thank you so much. This is great information for our patients and great service that we provide right here at McLaren.
I think so too. Thank you.
Yeah, thanks for joining us today.
Thank you.
And thank you for watching McLaren Port Huron Today's Health. If you have any questions about today's program, you can call us at 1-800-228-1484, or email us via our website at www.mclaren.org/phcontact. If you'd like to order a free copy of today's program or access reliable health information, please visit our website at www.mclaren.org/PHTH. As always, be sure to tune in next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.